Morning. My name is Bonaventure, and I'm the first year medical student of the Faculty of Medicine and Health Science. Today, I will be presenting about cardiovascular system. So, what is cardiovascular system? Cardiovascular system is the system that consists of heart, blood, and blood vessel. This system acts as the transport for nutrient and gases exchange all over the body. How? The heart will pump the blood through blood vessels, then the blood will carry oxygen and nutrient to the cells. Blood also carry carbon dioxide and waste and eliminate them from cells and help regulate acid-base balance, temperature, and water content of body fluids. So, the blood component also help defend against disease and repair damaged blood vessels. Let's look at the anatomy of the heart. So, heart is located at the mediastinum, superior surface of the diaphragm, left of the midline, anterior to the vertebral column, and posterior to the sternum. Other than that, heart also have its own border. So, the superior border lies along the line joining third, right, and second left costal cartilage, and the right border lies along the line joining third and sixth right costal cartilage. The inferior border lies along the line joining sixth right costal cartilage to the fifth left intercostal space on the mid-clavicular line, and the left border lies along the line joining second left costal cartilage to fifth left intercostal space at the mid-clavicular line. So, heart consists of four chambers. First, right atrium, right ventricles, left atrium, and left ventricles. As for the valve, there are two types of valve, which are semilunar valve and atrioventricular valve. The semilunar valve can be classified as aortic and pulmonary semilunar valve. As for the atrioventricular valve, they are tricuspid and bicuspid valve. Moving on to the types of blood vessel, we have arteries, veins, and capillaries. So, there are three types of arteries, which are elastic arteries, muscular arteries, and arterial. So, elastic arteries allow valve expansion to accommodate large volume of blood ejected from heart, and the expanded elastic walls will recoil to push blood to move forward through the vascular channel. For the muscular arteries, it allows the regulation of its diameter through vasoconstriction or vasodilation, hence blood flow can be controlled. Lastly, for the arterial delivers blood to capillaries. Move on to veins. We have large vein, medium-sized vein, and veinule. Medium-sized veins contain small amount of smooth muscle, and venules are the smallest veins and drain the capillary. So, veins have valve which is in the large vein. Next, moving on to the circulation, we have pulmonary circulation and systemic circulation. The pulmonary circulation is the circulation that moves blood from the right side of the heart to the lungs and back to the heart, while systemic circulation moves blood from the left side of the heart to the head and body and returns it to the right side of the heart. That's all for the anatomy. Let's move on to the physiology. The first one is the conduction of heart. So, heart conduction begins with the sinoatrial node generate action potential and it conduct along the atrial muscle fibers. Hence, the atrial muscle will contract. Second step is when the action potential reach the atrioventricular nodes and slowly distribute. This delay provides time for the atria to empty their blood into the ventricles. Next, the action potential enter the bundle of His from the AV nodes. Next, the action potential will enter both the right and left bundle branches. Lastly, the large diameter Purkinje fibers rapidly conduct the action potential from the beginning apex of the heart to remaining ventricular myocardium. Hence, it will cause the ventricle to contract. Moving on to hemostasis. So, what is hemostasis? Hemostasis is a sequence of response that stop bleeding to avoid blood loss. So, there are three mechanisms. The first one is vascular spasm. Vascular spasm occur when the circularly arranged smooth muscle in their walls that will contract immediately when arteries are damaged to reduce blood loss. Next, the spasm is caused by damage to the smooth muscle by substance released from activated platelets and by reflex initiated by pain receptor. The next mechanism is coagulation. Coagulation is when blood forming a gel involving clotting factors. There are two pathways. The first one is the extrinsic pathway and the second one is the intrinsic pathway. This pathway will lead to the formation of prothrombinase. Then the prothrombinase will convert prothrombin into enzyme thrombin, and the thrombin will convert soluble fibrinogen into insoluble fibrin, then forming a clot. Lastly, the platelet plaque formation. There are three steps. First, platelet adhesion. The second step is platelet release action, and the third step is the platelet aggregation forming a platelet plaque. So, how this mechanism is regulated? This mechanism can be regulated by the fibrinolytic system. So, the fibrinolytic system consists of endothelial surface factors, localized clot formation, and heparin. For endothelial surface factors, we have prostacyclin that will inhibit platelet adhesion and release. For the localized clot formation, we have thrombin that will be absorbed by fibrin fibers to prevent excessive spread of clotting. Lastly, heparin that will be produced by basophil in plasma, act as anticoagulant with antithrombin 3. That's all for the physiology. Next, for the biochemistry part. For the biochemistry part, I will be presenting about the ATP production, which consists of three processes. So, this process occurs in cardiomyocytes. The first process is glycolysis, which is the process of broken down glucose to produce energy in the form of ATP. So, it has two phases, which are investment phase and payoff phase. This process will not require oxygen and occur in cytoplasm. It will produce 2 ATP. The next process is TCA cycle, which is the oxidative metabolism of carbohydrates being converted to carbon dioxide. So it has 10 steps. This process requires oxygen and occur in mitochondrial matrix. It will produce 2 net ATP, 6 NADH and 2 FADH2. Lastly, the electron chain transport. So, electron chain transport is a process involving a cluster of proteins that transfer electrons through a membrane within mitochondria to form a gradient of protons that will drive the creation of ATP. This process requires oxygen and occurs in inner mitochondrial membrane. So, one electron moves through a series of electron transporters that undergo redox reaction. The accumulation of hydrogen ion in the matrix occurs. After that, the form concentration gradient causes the hydrogen ion to diffuse out of the matrix space by passing through ATP synthase to phosphorylate ADP to ATP. That's all for the biochemistry part. Next, we'll discuss about the disease and treatments. So, the disease that I chose here is the acute myocardial infarction, which is the situation occur when blood flow that brings oxygen to the heart muscle is severely reduced or cut off completely. It will cause the death of heart muscle tissue. The cause of acute myocardial infarction is due to blood clot and arteriosclerosis. There are seven symptoms here. The first one is the severe chest pain that may radiate to jaw and left arm or both arms. Second, the shortness of breath. Third, sweating. Fourth, feeling sick or faint. Fifth, mild discomfort in chest. Six, heartburn. And seven is feeling like indigestion. Moving on to the treatment, we have angioplasty, which is special tubing with an attached deflated balloon that will thread up to the coronary arteries. The balloon is inflated to widen blocked areas where blood flow to the heart muscle that has been reduced or cut off. Second, minimally invasive heart surgery, where an alternative to standard bypass surgery using small incisions. Lastly, the stent procedure, where a stent is a wire mesh tube that is placed during angioplasty to hold open an artery and restore blood flow. Moving on to the figure in cardiothoracic surgery, this person is Tan Sri Dr. Yahya Awang, born in Singapore on September 7, 1950. He takes the MBBS in Monash University on 1974 and had FRSC in Glasgow 1980 and trained as a cardiac surgeon at Brompton Hospital in London from 1980 to 1983. The achievements of Tan Sri Dr. Yahya Ahwang are becoming the head and senior consultant cardiothoracic surgeon from July 1985 to June 1992 at Kuala Lumpur General Hospital. Next, successfully performed the country's first heart transplant operation in 1998. Next, pioneer of the establishment of the National Heart Institution (IJN), becoming a medical consultant surgeon from July 1992 to September 1998 at Kuala Lumpur General Hospital. He also performed two coronary artery bypass on Prime Minister Tun Dr. Mahathir Mohamad in 1989 and 2007. He became the chairman of the National Transplant Registry and a council member of the Association of Thoracic and Cardiovascular Surgeons of Asia. The latest, he became the Pro-Chancellor of University Technology Malaysia from 2011 to 2016, awarded the Merdeka Award in 2013, becoming a Chancellor of the International Medical University (IMU) in 2021. And lastly, he became a chairman of Cardiovascular Centre Kuala Lumpur. So that's all from me. Thank you for watching.